welcome to our newest body signals topic, digestive problems. For those of you that don't know, every single month for the past, this is now our 9th month, every single month we've done a new topic, health-related topic that we focus on, that very common things that we deal with here in our practice. So we want to educate our community as best as possible. So we know that education is power, so knowledge is power. The more that you guys know how the body works, the more empowered you're going to be, and the better results that you can get, and you can share with other people that you know about things that you're learning. As far as for tonight, it's going to be digestive issues. So this topic, when we decided that September was going to be the digestive month, that was going to be our topic. It was a topic I knew was going to hit home pretty well for me. For our little guy, I don't know if for everybody here, we have a little boy named, his name's Liam. He is going to be he's 19 months right now. Liam, when he was born, super healthy kid, no issues at all for the first like 3 months. And then once he turned 3 to 4 months, we started noticing he had all types of skin rashes showing up, especially on his face. And what we noticed, well, we really didn't know exactly what was going on. Took him to a few specialists, and what it came down to was sensitivity to food. It actually was a digestive issue that was expressing itself outward on his skin. Okay, I'm going to show you kind of what he was dealing with. This is our little guy. When he was born, this was at about 4 months old, he had really bad rashes on his cheeks. Really bad rashes that were actually scabbing. Some of them would actually come off and they were actually bleeding. And we did a bunch of studies, a lot of expensive testing and all sorts of things to figure out exactly what was going on. And what it came down to was there was an issue with his digestive tract. And that he basically had a leaky gut that was releasing all the toxins from the breast milk into his body that he wasn't really able to absorb and process. So we had to do a bunch of food testing and figure out exactly what it was, because he was only breastfed for his first like 6 months or so. And my wife, Dr. Dolly, she had to literally reduce her diet down to like only whole foods. She had to eliminate eggs, dairy, gluten, nuts. What else? There was about 6 different, soy. There was about 6 different nutrients that she had to completely eliminate from her diet, and then from there kind of try to figure out exactly what it was. It took a long time. It took several weeks and actually a couple months to finally start to see some changes, but eventually his skin started to have less of those red patches. He also had some on his like butt. He had some on his the side of his torso, and then they started to kind of heal. And now you can look at him, and he's got clear skin. He's super clear skin, super healthy now. But it took a process of kind of elimination and figuring out exactly what's going on. And it made me realize. I mean, I've always known. Most people know that the food you eat is kind of important, and its digestion is a big aspect of health, but like it really made me realize like, wow, if you're not feeding your body the right foods, and if your body has some sort of dysfunction that's happening, it can really affect a lot of things. And he was very uncomfortable, and he was always scratching himself. So this digestive topic definitely hit home when I was preparing this. Now, the topic of body signals is, the reason we call it body signals is because a symptom is a signal. That is what we have to kind of wrap our minds around, that a symptom is not a problem, it's really just a signal of what's going on, okay? The symptom is always going to be the tip of what we're aware of. In order for something to be a symptom, you have to be consciously aware of it. Just like if you're the Titanic and you're going across the ocean and you see something poking out of the surface, that's what they see, that's what you're aware of, but there is an underlying bigger root cause issue. And so the body signals program that we have been going over the last several months is our way of kind of helping you to think differently about the symptoms that you may be experiencing. Okay. help you understand exactly what it is that could be actually causing that. What you have to start to kind of develop a skill for is being able to listen. Because if you don't listen to your body when it's starting to kind of whisper, eventually it's going to get it's going to start screaming, and it's going to be this big aware. You're going to be very aware of what's going on because it's going to be screaming at you, and you're going to be not able to do the things you love to do. So we want to try to start learning the skills of listening to your body. Some of you may have seen this. We'll be going over this in some of our workshops, and I think it's just an awesome way of putting a visual on health. Now, this is on the far right is high-level wellness. Okay, this is where we ultimately want to focus on. And the far left side is premature death. Okay, there's this illness and wellness continuum. Now, most of our consciousness, when we think of health, we're focused on the left side. Most people, okay? Most people think of wellness as just not being symptomatic, okay? But if you look at this, neutral is right here, okay? So most people are either living here or on this side. Very few people are actually living in what's called wellness. Now, by the time we start to actually take action on our health, there's usually been a symptom that's been our motivating factor because we're aware of it and it's bothering us, right? So a symptom, if you look at it though, is already here. By the time you're feeling a symptom, that's your body's way of telling you something's going on. Now, if you ignore the symptoms, then eventually there's a disability that happens. You become disabled and you're not able to function, and a lot of the times that's permanent. And then if you ignore that long enough, then you expire before your time, okay? Now, there's this aspect right here of signs. A sign is something that you don't feel, but you can measure, okay? So this is for an example of this, something that we see here in our office. A sign would be, let's say, you come in for your appointment, you refer somebody, your loved one in for their appointment, let's say a partner or friend, they come in for their appointment and they're like, yeah, I'm just here because I just wanted to get checked up. I was recommended to come in, but I don't really have anything going on. I'm feeling pretty good. But then we do some testing, and an example of a sign would be something like doing range of motion testing or doing a posture assessment, and we're seeing dysfunction happening, okay? They might not be aware of it, and some of you guys, this might be accurate for you, that you didn't really realize that maybe your posture was this bad, right? Or you didn't realize that you had degeneration happening in your spine, right? If you do some testing and you actually measure, those are the signs that tell us, okay, well, we're not on this side, we're actually on this side automatically. That makes sense? Now, the only way to actually move towards the right is by becoming aware that health doesn't necessarily mean just being symptom-free. So it's that awareness and then the education. Education, the more aware you are, the more educated you are, then you can actually learn how to feed your body the right things, do the right things that actually your body requires to be healthy, and that's how you shift into high-level wellness. That make sense? Okay. This is called the wellness paradigm. That's what we operate in as chiropractors. Okay, we focus on wellness. The medical field focuses on treatment, because what is the main objective of medicine? They're going to prescribe a medication to cover up the symptom. So basically what's happening is once you just cover this up, there's still signs happening. And if you ignore the sign, if the signs are still there but you're not aware of it, and then you just don't feel the symptoms anymore, and you keep on doing the things you're doing in the first place, well then you're going to pretty quickly get to the point of disability, and then to the far left side, right? That's medicine, that's treatment paradigm. So that's why we operate in wellness paradigm, but it does require awareness and education and growth, and that's why we're doing this. Cool? All right. Now, this brings me to an important point before we jump into digestive system. We got to start with the master system of the body. Let's do some kind of an anatomy lesson here. Anatomy and physiology, all right? So the nervous system, the central nervous system is the master system of your entire body, okay? We have to understand that because because it controls every cell, organ, and tissue in your entire body, well, if we only focused on the digestive system and ignored potential dysfunction in the nervous system, would you guys agree that maybe we're missing a key aspect? right? So we have to understand that first things first, everything starts in the nervous system and then goes to the other systems, okay? Now the nervous system can be broken up into three different things, okay? Three different areas: motor nerves, sensory nerves, and autonomic nerves. Motor nerves, think of a motor as something that moves, right? So motor nerves are the part of the nervous system that tells your muscles to move. It's just think motor muscles, okay? It's something that's going to tell your muscles to contract. Autonomic nerves are the things that that aspect of your nervous system controls the things that are automatic. So heartbeat, respiratory rate, digestive tract, okay? But this is about 40% of your nervous system. This is about 40% of your nervous system. So that's 80%, only about 20, and actually newer studies are showing about 10 to 15% of your nervous system is actually responsible for sensation. So sensation, it's in the name, since sensory is responsible for pain, hot and cold, and also postural awareness. So if you think of that, 10 to 15%, we can round up to 20, but still, the minority of your nervous system is actually responsible for that sensation of pain, okay? So if we're using this paradigm and we're saying that, okay, well, as long as I'm symptom-free, I'm healthy, but then only 10 to 15% of our nervous system is actually responsible for symptoms, it can take a lot to actually become symptomatic, right? Think of, have you guys ever heard of a time where like somebody went to go get a normal checkup at like their family physician, and they find out they got something going on that's like pretty serious, maybe cancer, maybe diabetes, maybe heart disease. They didn't know anything was going on, right? So that's this whole thing in play, okay? It's the sensation, you can't judge it based on just sensation. You can't judge your health based on sensation, okay? So, starting there, now there's a few dangerous belief systems that I want to kind of go over, okay? Number one, that drugs work, okay? And prescriptions, okay? But if we put all our faith in a drug, what is a drug doing? We kind of already went over this. A drug covers up the symptom, correct? So if we just cover up the symptom, and then there's still the sign that leads to disability, you can't just, a drug isn't going to actually fix it. That's not going to create health, right? If you give a drug to somebody that's on diabetes and you give that same drug to somebody that's not on diabetes, it's going to have a completely different effect, and it's actually going to create more issues, right? So you can't just say this drug is going to make a person healthy, right? In general, right? So we have to kind of abandon this belief that like, okay, the drug is the fix. The drug is what is going to get me to where I want to be, right? It's literally only operating that treatment paradigm that far left. Now, good old USA, we have marketing that it's legal for medical companies and prescription medical companies, big pharma, to be able to market to the general public about their products, okay? Most countries that is completely illegal, right? Think of Larry the Cable Guy and his Prilosec commercials, okay? He talks about, so most people, general public, they assume that they're in that treatment paradigm, that's all they have ever known. They've never known anything about wellness because they haven't been educated. So they will focus on that treatment paradigm, and they get a celebrity telling them, hey, this drugs equal health in their mind. This is what's going to get you healthy, okay? And he's there at a carnival in front of a corn dog stand talking about health and medication and how this is supposed to get you healthy. But you ever listen to those commercials where like at the end, they're like, side effects may include, and it goes on. It's like, that part is longer than the actual promotion of the product. Okay, so let's look at Prilosec. Side effects. Headache. Okay, well that's not a good start. Abdominal pain. This is supposed to be this is supposed to help you with digestion, and you're getting abdominal pain. Well, that doesn't really, that kind of defeats the purpose. Irregular heartbeat, so not only does it affect your digestion, but then also affects your cardiovascular system. Persistent muscle spasms, so then we got the musculoskeletal system involved. Seizures, that's the nervous system. Diarrhea, it's supposed to fix digestion, and now it's creating more issues. Abdominal or stomach pain or cramping. Fever, okay, so your body's going to assume that this is a foreign invader, and it's going to try to heat up and try to kill it, when it's not able to do that because it's not an actual bacteria or virus. You can then get blood or mucus in your stool. Okay, well, that's not really fixing much either. That's creating more issues. rash, itching, swelling, especially in the face, tongue, or throat, continuation of the digestive system, severe dizziness, and trouble breathing. So then we got the respiratory system. This is what majority of the medical paradigm, it's one medication provides somewhat relief for one issue, relief, not actual cure, and then it creates all these other issues, okay? So we need to kind of abandon that whole belief that drugs work, okay? That drugs are the actual cure. Another dangerous belief is that your problems will just go away if you ignore them. This is a very, very dangerous belief, okay? I've done this, most of us have done this, that once you kind of get like something, maybe it's an ache and a pain, or maybe it's an upset stomach, or maybe it's something that shows up, or a headache, and you're like, oh, whatever, it's just, it'll go away, okay? But who here would say that your body is smart?
Of course.
Okay, your body is extremely smart. It is the most brilliantly designed, functioning organism that has ever been created, okay? If your body would just randomly create a symptom, and we just say, oh, it's just my body being stupid, it'll go away. It doesn't know what it's doing. Well, then we're not actually training ourselves to listen to our body and be like, okay, what could this possibly mean, okay? So instead of just covering up and just being like, okay, well, maybe this will just go away on its own, we need to start thinking differently, okay?
So, I'm sorry, Doug.
No,
So as an example, you're saying like, I'm just getting older.
Yes,
You know, like
yes.
when you start snapping and popping and, you know, having trouble.
Exactly,
You know, like,
yep.
you shouldn't feel like that, right? You should,
Your body should, yeah, exactly, that's a good point you brought up. So aging, while feeling pain and wearing down and all sorts of symptoms is very common as you age, we have to differentiate common and normal. So normal is healthy. So as long as you start, if you're proactive with health throughout your life, and you actually listen to your body and stay proactive with it, getting adjusted, regular exercise, good sleep, there's a lot, and I'm just going to dive into that right now. That is where you're going to be able to sustain health later as you get older. Because as soon as health starts slipping, it takes a lot of energy to get back up, right? So if you can sustain it at a certain level, you're going to be much better off later on in life, and you're going to reduce the chances of having that kind of decline.
because maintenance is always better than fixing, right?
Exactly, yep, exactly. So, now, we have to kind of, so when we're talking about, you know, if you just ignore it, it'll go away, we have to kind of abandon that belief. Well, we have to then understand, what is it that causes issues in your body in the first place? And what it is it's some form of stress, okay? So if your body is naturally, innately designed to be smart and healthy, the only thing that would cause it to not be that way is some form of stress, okay? There's three different kinds of stress. There's thoughts. Thoughts will be things like emotional stress, okay? Thoughts can be things like stress at work, stress at home, okay? That's why we always say like an attitude of gratitude, that's what we want to have, right? Being thankful, just having a positive outlook on life has a huge impact, literally physiologically, okay? They've done studies of like they've done studies of like plants and things like where they have one room of plants where there's like heavy metal music, angry music playing all the time, and plants with like happy music. And you look at them, the same time frame goes on, the plants in the angry music, they actually die way faster than the plants. Like it's just like it's a biology fact that the happier you are, the less stress you're going to be. Okay. Now there's a thought aspect, so the cognitive aspect. There's the toxins aspect, which hits home especially with the digestive topic today. So toxins are things that we put into our body. It could be nutritional. It could be something that we breathe in. It could be the medication that we take. Those toxins that enter our body are a form of stress as well. And then the traumas. Okay, so traumas can be macro traumas like car accidents, obvious things, car accidents, slips and falls, sports injuries, and the much more common, those are like 5 to 10% of the actual traumas that your body goes through. The majority of it is the micro traumas. It's our repetitive slouching, it's our repetitive cell phone use, texting on your computer, whatever, being on your computers or driving. It's the repetitive stress on your body that actually creates the majority of the physical stress. Okay. So the better premise, the better belief system, we have to start off from the top. Healthy is normal, okay? Your body's not designed to be sick all the time. That is not normal. Your body is smart. Your nervous system is the master system. You need to think of your spine as your suit of armor, okay? Think of your brain being protected. Your brain is inside your skull. Think of your skull as a helmet, literally. Your body was designed very, very intelligently. So you have a helmet protecting your brain, which is the master control center of everything. And then your spine protects your delicate spinal cord, which runs all the way down. Your nervous system is very delicate, okay? That's the one susceptibility, the biggest susceptibility that your body has. Your nervous system is very, very delicate. But thankfully, we have a suit of armor. So think of your spine as a suit of armor to actually protect your spinal cord, and then your skull as the helmet to protect your brain, okay? So we have to understand that. And then lastly, modern life is unnaturally stressful. Life has always been stressful, right? Even from the beginning of time, there's always been stressors. But modern life has caused our stress levels to skyrocket, right? I'm going to jump into adaptive physiology and just kind of talk about how does our body actually respond to stress. If you think of just eons ago, at the beginning of time, we had a stress of, let's just say, a tiger chasing you, okay? A tiger starts chasing you, this is what your body's going to go into. It's going to go into what's called fight or flight or sympathetic mode, okay? So blood pressure is going to shoot up. There's going to be increased heart rate. There's going to be increase in muscle tone. You got to have your muscles firing. There's going to be higher levels of cholesterol, which is a stress hormone and causes, it helps with wound repair. Clotting factors are going to start to go up. There's going to be a lot more fear and anxiety, but then also insulin sensitivity goes down, okay? But think of short-term escaping from a tiger. These are the things that immediately happen. Blood sugar goes up, okay? You need that fuel to actually burn the muscle, that the muscles can actually burn or run away. Immune response is downregulated, okay? You don't need to fight a bacteria when you're fighting a tiger, right? Sex drive is going to go down. Decreased serotonin, sleep cycles are going to be interrupted, and then digestion slows or stops. Now, this is how your body interprets any stress, whether it's physical, so thoughts, traumas, or toxins. Any of those stresses, it's going to respond in the same way because it's under stress, okay? So whether it's a tiger chasing you, or whether it's a chronic stress of being like this all the time, or whether you're constantly having negative thoughts, your body's going to be in this constant fight or flight mode. Digestion is going to be affected. Not only that, sleep, sex drive, diabetes can result, right? If you're constantly having high blood sugar, you're constantly, your insulin is downregulated, all this stuff will start to show up. And then look at the cardiovascular system, blood pressure's going up, heart rate's going up, clotting factors are going up. This is just your body's innate way of dealing with stress in general. Does that make sense? So, we need to kind of touch base on that because it's a very brilliant, it's a perfect response or adaptation to an acute stressor, but if it's a chronic stressor, chronic and acute, you guys know the difference of that? Acute is short term, chronic is long term. So an acute stress of a tiger chasing you, yeah, you want all of this to happen because you got to get away. But if it's a chronic stress where your body's doing this exact same thing over in a long period of time, weeks, months, and years, that's a much bigger issue because this is literally happening all the time in your body. Make sense? So, the autonomic nervous system has these two divisions, okay? Autonomic, you guys remember what that means? Autonomic means automatic, okay? Basically think of digestion, respiration, heart rate, those kind of things that just happen without you having to think about it. So that part of the nervous system has two divisions, sympathetic and parasympathetic. Sympathetic is that running away from a tiger. I'm under stress all the time. I have constant stress in my life, fight or flight. That's another kind of way of phrasing it. Parasympathetic is the opposite. It's the rest and digest, like I was just going over. Now, this is one of my favorite kind of depictions of the nervous system. Whenever I explain the nervous system and kind of how the spinal nerves work, I love using this slide because everybody can relate to a fuse box, right, or circuit breaker. Every single nerve in your body goes somewhere different. Okay, every single nerve that's coming out from your spine Okay, you have 24 pairs on the left, or 24 nerves on the left, 24 nerves on the right. They each go to somewhere different. If your brain needed to tell your heart, hey, I need more power, more strength, more healing, it's gonna increase that output, okay? But what would happen is if I took a scissors and I just cut the nerve that went right to the heart, what do you think would happen? Would the heart function anymore?
You die.
It would die, right? Now, obviously, we're not doing that, but that doesn't happen in a daily life. But think of, if we trace it back a little bit further and we go back to the spinal level, if there's a stress on the actual nerve root where the nerve comes out, and there's a stress there where the nerve can't get out, it's very similar, right? It's not a severed nerve, but it's a pinched nerve, okay? Which has a very similar effect over a period of time. That chronic pressure will lead to dysfunction and then eventual death of that tissue, okay? So that subluxation, let's go through this. The subluxation, we love using this word because it's literally what we're fixing with chiropractic care. It's a joint misalignment, creating soft tissue damage, okay? Creating inflammation. If you roll your ankle, there's gonna be a joint misalignment in your ankle, and that's gonna create some soft tissue damage, probably a tendon sprain or strain, which will then get swollen up. You'll get inflammation. That will create a muscle spasm, which is your body's way of saying, hey, don't move me anymore. I'm just gonna tighten up and I'm just gonna splint it, right? But a muscle spasm in your back, you guys ever had that? Muscle spasm in your back? Not very fun, right? But it's your body's way of being like, hey, get off this area. Give me some breathing room. And then what happens is lost inhibition, meaning that the disc stops moving. The disc is the cushion. It's supposed to be like almost like a water balloon that you can kind of press, and it'll allow some movement. Well, lost inhibition is where it actually kind of just solidifies, and you can't move very much. Okay, almost like think about a water balloon filled with ice, right? It's not going to really move anymore. And that creates a joint fixation, where then the joint is fixated, or meaning restricted, it can't move anymore, which is a form of physical stress in your body. So what does your body do in a form of a physical stress, or any stress? Stress hormones. Cortisol, which triggers this whole adaptive physiology. That make sense? Okay. Now, what creates those subluxations in the first place? Like I said, it's very easy to kind of see why a car accident or a slip and fall can kind of create that. But that is, like I said, 10 to 15%. Majority of it is going to be our repetitive slouching, our repetitive habits, our sleeping position. That stress over a period of time in your spine will lead to the same exact stress that we just saw there, okay? Now, let's jump into some of the digestive complaints, okay? Let's just jump right into it. Chronic constipation, right? Not fun, okay? So think of, now that we've kind of covered the nervous system, let's talk about specific digestive issues. Okay, so your digestive tract is literally, if you think of a hose, goes from about one end to the other, and it's compacted into one tiny little box, okay? That's about what it is. It has one opening and one opening. That's your digestive system, okay? Chronic constipation is where things are just blocked up, it's jammed up, okay? It's clogged up. There's something that's blocking everything else from flowing out, okay? It's not fun, obviously, because you need to be able to empty that tract out on a regular basis, but this is something that we see all the time. Chronic constipation is one of the most common things as far as digestive complaints that we see here in our office, because people eat terrible food, they're not drinking enough water. If they don't have enough water, then that hose there's going to be a lot of just gunk built up in there, and it's not going to be able to empty out. But there's also another component. From a spinal perspective, nervous system perspective, these are the areas that we typically see as a factor with this whole thing, okay? C1 to C3, L1 to L2, and L5 to S3, okay? So C stands for cervical, means neck. C1 to C3 is right up here, okay? Let me get out of the way here. So C1 to C3 is the upper three nerves in the neck, okay? Kind of like right underneath your ear. L1 to L2 is right where the curve goes from here to this one. That's L1 to L2. And then L5 to S3 is right here. It's the very base. So it's your tailbone and the bone right above it. Okay? Now, those nerves, let's look at where they go. I want to first go into L1 and L2. Okay, so let's start here. L1 and L2, like I said, is right at this transition right here. So L1 and L2, all of these nerves come out to your stomach, but then they also have all these long branches that go into your digestive system. Okay, so a lot of chronic constipation is usually an intestinal issue, an intestinal blockage. So if there's a, like I said, think of clipping that nerve that goes to the digestive system. Well, if part of the nervous system is responsible for sending signals to these organs that are supposed to work all the time, if you just snip one of those, it's not going to be able to move the food through, right? L5 to S3, well, that's down here. That goes to reproductive system, but it has a huge role to play with large colon, or large intestine, the colon. So again, part of the whole digestive tract. So making sure that that nerve supply is happening at 100% is very, very important. Sometimes we'll see some stress built up where if we take an x-ray, oftentimes that L5 or S1, that bottom disc right here, oftentimes this disc is just paper thin. And if that disc is paper thin, where it's looking like that, well then that nerve going out to the colon, that's like a clip nerve, right? That signal is really reduced. There's no way the brain's gonna be able to send the signal to the colon saying, hey, let's get things moving. That makes sense? So chiropractic adjustments help to take that stress off of it by releasing that pressure. Make sense? Now, C1 to C3, this is very, very, we explain this very often to our patients, that because it is kind of a weird concept, like how could something in my stomach be caused from something up here, okay? C1 to C3 though, there's this really important nerve called the vagus nerve. Not Vegas, not like Las Vegas, V-A-G-U-S. Vagus is Latin for wandering, okay? So when they named all the anatomy, they named it vagus because it literally wanders from the top of your neck, the base of your brainstem, goes all the way down into your digestive tract. It's the longest nerve in your body. So it comes out right behind your ear, and then it goes down, controls some of the heart and lung function, but then it goes all the way down to spleen, stomach, liver, kidney, and intestines. Okay? That's kind of a more of an accurate kind of depiction of what it actually looks like. It literally has like 1,000,000 branches and it goes all the way around, but it starts from up here. That's why we always talk about the cervical curve. It's literally the curve, like we call it, in chiropractic, we call it the arc of life. Because if you have stress up here, and it's compressing on all that vital communication that's literally controlling everything, your body's not going to function well at all. That's why we're super, super passionate, and those traction exercises are so, so important that we get a healthy curve in your neck so it takes the stress off of up here. That makes sense? Okay? Let's jump into some of the more intestinal specific issues of irritable bowel syndrome, Crohn's disease, and celiac. All right. Now, IBS or irritable bowel syndrome and Crohn's disease are very closely related. They're both have a similarity where they have ulcers that show up throughout the colon and throughout the small intestines. But let's talk about the actual anatomy of the lining of the intestines. So this is actually, it's called an electron microscope. And what it actually does is it zooms in like thousands of times, okay? So this is like a tiny, tiny little biopsy of an intestinal wall, and it's zoomed in like 1,000 times. This is actually what the inside of your intestines look like. It's filled with these little microvilli. And what they do, when we were designed so intelligently that instead of just a smooth surface, that which doesn't have a whole lot of surface area, if you raise up and get a lot of different things coming off of it, well, that increases your surface area that much more, which then allows you to absorb as much nutrients as possible. That make sense? Okay? So your gut wall is made up of millions of these little microvilli, little fingers that come out, and they're really, really tightly packed together, okay? So that your body can absorb as much nutrients as it possibly can. A lot of people, have you guys ever heard the saying of, you are what you eat? You guys hear that? Mm-hmm. So technically that's not true. You are what you absorb, okay? Because if you are what you eat, there's a lot of issues that can happen in your digestive tract that don't actually that if you're having these issues, the food doesn't actually get properly absorbed. So then it never actually reaches the rest of your body. So you actually are what you're absorbing. So if you're having absorption issues, which is very common through Crohn's, through irritable bowel syndrome, and celiac, that's where you are what is actually being released into your blood system. Okay. Now let's talk about celiac. This is specifically for celiac. Celiac is a gluten sensitivity, hypersensitivity. Now, if you eat a lot of grains, people used to think of bread as being like the best, type of food for you, and it does have some benefits, but for certain people, it's very, very toxic. Okay, because grains in general are acidic in nature. Okay, they have some of them, especially like enriched white flour. Okay, which is most bread and most crackers and things like that, have a low nutrient density. They're essentially just sugar. They're high in omega-6 fatty acids, which are very pro-inflammatory, which creates a lot of inflammation. They have a high glycemic index, which means they're basically, your body interprets it as sugar, okay? Just white sugar, table sugar. And then some of the toxic properties, or the irritant properties, are coming from phytates and lectins. Lectins is mainly found in gluten, and the anti-nutrients aspect of the phytates is basically like, it is an anti-nutrient, so it literally strips your body of the good nutrients that it needs. Okay, it's very toxic. And so these are some food groups will be like things like wheat, rye, and barley. Okay, now celiac, irritable bowel, Crohn's, those are kind of classified as a leaky gut syndrome. So if you think back to the leak, think of those microvilli. Okay, this is kind of an illustrated version of it. Think of those microvilli, and this is very similar. It's a very similar mechanism of what happened with Liam with his skin rashes, because it'll actually express itself in other tissues, and very commonly it'll express itself in the skin. You'll get the rashes. So those are very common with Crohn's and irritable bowel. Make sense? So let's talk about some things that you should, some takeaways, okay, as far as nutrition. What should you be consuming? Well, non-starchy veggies, okay? So potatoes are not a vegetable. Don't think of that as a vegetable, all right? I wish they were. I wish potato chips and French fries were on this list, but unfortunately it's not. Non-starchy veggies, incorporating some fruit. Fruit, you just have to realize that it is a sugar, so there's definitely some benefits to eating fruit, but you don't want to just have fruit smoothies all the time. There's a lot of sugar in there. Making sure you're eating good quality meat, poultry, and fish. Ideally organic, natural fed, range-fed eggs. So not caged eggs, because the amount of, if you are what you eat, but you also are what you absorb. If the chicken is not eating the right food, then that's going to be absorbed in you. It's literally just a chain, okay? So we got to make sure that what we're eating is also eating good food. That's why we always try to go local, farm-raised, wild, as if at all possible, and for eggs, cage-free or range-fed. Natural fats, so these are going to be things like coconut oil, avocado oil. Those are really, really good for you. Those are anti-inflammatory. Some nuts and seeds, obviously in moderation, because those are also very high in fat, but definitely a good source of healthy fats. And making sure we're drinking water. Like I said, if there's a hose going through, you got to make sure things are getting flushed. So that all comes from the hydration that we put in our bodies. Things to stay away from would be refined carbs. So that's the enriched flour, the white breads, the Pop-Tarts, the crackers, and that kind of stuff. Those are just all, I know they're delicious, but they are going to be interpreted by your body as sugar, okay? Cereal grains as well, so Frosted Flakes and the Cheerios and that kind of stuff. Again, super processed. The fewer ingredients, the better. This is kind of a good rule of thumb. If you look at an ingredient list and it has the 2, 3, 4, ideally just 1, but 2, 3, 4 or less than 5, that's a pretty good option, okay? If you're comparing and you see one that has 5 and one that has 15, go with one that has 5. Oftentimes they are going to be a little bit more expensive, but you're investing into your health rather than just feeding your body garbage and then just letting it express into a bigger issue later on. Okay. Sweeteners, things like artificial sweeteners that you put in the coffee and stuff like that, and teas. Try to stay away from those. Those again are not, your body doesn't really know how to process that very well. Bad vegetable oils, so like canola oil and vegetable oil that we typically fry with, those are not very good for you. Those are not the best fatty acids. Excessive legumes or beans that can create a lot of gas in your body, obviously. And if your digestive tract is full of gas all the time, again, it's not going to be able to empty out. Dairy products, be moderate with your dairy products, as well as soda, juice, and alcohol. It kind of goes without saying, but dairy products, just think about it this way. If we were designed to drink cow's milk, we wouldn't have a mom that was able to breastfeed, right? If that's how we were designed to be, well, God wouldn't have allowed our mamas to be able to breastfeed, right? We're designed to have that type of milk, not milk from another mammal. That makes sense? Okay?
Touching on what you just said, yeah, because one of the guys explained it to me. He said, cow's milk is made to make a baby cow fat.
Exactly. Exactly. Yep, that's exactly it. It's designed for specifically, like, we wouldn't drink monkey milk, we wouldn't drink sheep. Well, yeah, some people do drink sheep milk, but it's designed for that type of animal, right? We are designed to drink mother's milk. Okay. Let's talk about what we typically see in our office with these issues of the IBS, Crohn's disease, and celiac. It's going to be C1, T7, and T11. Okay, C1, again, kind of going back to that vagus nerve coming from the base of the brain, and then T7 and T11. Look at where those go. That's basically the right at the bottom half of the curve in your middle back. Those nerves go to stomach. Okay. And then they also go into this main plexus right here, which goes to the intestines. So very, very common areas that we see for those kind of more intestinal issues. Now, another very common one is acid reflux and heartburn. Anybody ever deal with this?
Yeah.
Not very fun, right? So think of, let's talk about some anatomy here. Your stomach is kind of the initial container of the chewed food. So you chew the food, passes down through your esophagus. When you starts out, there's already starting some salivary enzymes that start up in your mouth, and then it passes down through your esophagus. Your stomach is full of acid, really, really, really strong acid, and what that does is it basically just breaks it down and digests it into small bits that your body, your intestines can then process even more, and then help to pass through the lining into your bloodstream. But what can happen is, if this muscle, it's kind of like a ring, it's called a sphincter. If that muscle is not firing properly, it's weak or it's enlarged and it's not able to close fully, well then what happens is if you eat a big meal, then your body, think of a water container. If you fill it up with solids, well then it's going to start to raise the liquid up, and then it's going to start to pass into the esophagus. The esophagus, the burning sensation is the actual stomach acid passing into the esophagus. That's what heartburn is. It feels like it's in your heart, but it's actually your esophagus. That make sense? So that's what's going on there. Now, because this is actually a muscle, it's a muscle that closes to prevent acid reflux, this sphincter, if that is not firing properly, if that's not able to fully close, then a lot of that can be relating to a nerve. If the nerve isn't firing, well then the muscle's not going to fire. That makes sense? So oftentimes what we'll see here is T4 and T6. So apex of the curve. That goes right to your heart, right to your lungs, and it comes right down and into your stomach. That's a very, very common area that we'll see. Now, the issue with this is if you're having stress, if the root issue is actually stress at T4 and T6, and that's the apex of the curve, well then think about what position or what daily thing that we do that could cause stress right there.
Yes.
This constant forward leaning, rounded shoulders, that's literally all that pressure builds up at T4 and T6. Okay, so that compresses on the nerve. If the nerve that goes to the stomach is compressed and that sphincter is compressed, well, or that sphincter is not able to fire, then it's going to lead to some acid reflux. Does that make sense? Let me show you a testimonial that we had. This is Trent. This was done during Halloween time. That's why I'm in a Superman costume. But Trent came in. He was actually referred in by his girlfriend, who was a patient here, and so he was referred in. He'd never really been under chiropractic care. And I remember doing his consultation, and I'm like, so what's bringing you in? What you got going on? He's like, I mean, I have a desk job. I have some neck stiffness, got some lower back issues just from playing football over the years, and he's a young guy, fit guy. I'm like, okay, any other health issues you got going on that you want me to know about? He's like, I mean, I got acid reflux, but I don't think that's gonna, I don't think that's for something that chiropractic can help with. I'm like, I mean, we'll see. We'll take a look at your x-rays and see what's going on. Went over his x-rays, sure enough, stress, right at T4 and T6. I'm like, hey, this is what we do, is we fix the stress in your spine. If there's stress in your spine that's affecting the nerves, and you got issues going on there, well, don't be surprised if you start to see some results, okay? So I kind of explained that to him, and he was one of our patients of the month, and his testimony is on here that we posted on our social medias. He said, ever since I started going to Outbound Chiropractic, I've made great strides in my health. I've seen improvements in my posture, neck pain, and even my acid reflux. Dr. Connor takes a scientific approach to your chiropractic therapy. By performing a variety of tests, you're able to track your improvements with real data. Highly recommend Outbound Chiropractic for their friendly, positive attitude and real results. So, pretty cool, but the fact was that, my favorite part was that he's like, I don't think this is something you're gonna really, I mean, you need to know, but I also have acid reflux. And all of a sudden, after a few weeks, he was under care he was patient of the month, his like second or third month, but I mean, he was already starting to see these changes that he had been dealing with, and he's been medicating for years, and all of a sudden, take the stress off. That was actually what was really the core issue. But again, he had a desk job. He's an engineer, so he's literally at a desk all the time doing like drawings and stuff, and so he's literally always leaning forward, and that's what was creating so much that issue. It's a micro trauma from our repetitive daily habits. Tech neck or text neck, right? It's this all the time. Modern life is it's unnaturally stressful. We've never before in society have we ever seen so many people looking down. You go anywhere, go to a restaurant, go to even the gym, or go anywhere in the airport, and you'll just see people literally all the time like this. And we're wondering why our health is just plummeting as a society. We're spending way more on medication than we've ever have, and we're not getting anywhere, right? Just take a look at what we do on a daily basis. Again, how do you know if you even have a subluxation? Well, here at Outbound, we have 5 objective criteria. You gotta look at instrumentation. So instrumentation is gonna be things like posture assessments, it's gonna be nerve studies, it's gonna be EMGs, we do those on a lot of our patients. We have motion palpation and static palpation. So what palpation means is feeling, so we use our fingers. Chiropractic means the use of hands. Chiro means hand. So what we do is we use our hands and then feel to see exactly how the spine is moving. Your spine is designed to have a certain feel or consistency. If it's not moving properly, we're going to be able to detect that, okay? So palpation is huge. Visualization, again, posture. We can see if you're dealing with a lot of this. A trained chiropractor can know pretty well, okay, we're probably dealing with a C7 or C6 or T3. You know, we can kind of pinpoint what's going on, and then we get even more specific with visual x-ray. You got to kind of go underneath the surface to see exactly what's going on. Okay. Again, how do you correct the cause of the issues? Three-legged stool. Three-legged stool. We preach this all day long. There's 3 things you got to do. You got to break your bad habits that are creating the issues in the first place, whether that's what you're putting in your body, your eating, your nutrition, whether it's your sleeping positions, whether it's your ergonomics while you're at your desk. Those kind of things are the bad habits that create a lot of the stress in your body. Add your specific exercises, okay? Your body's designed to move. We don't want to just be sitting down all the time and just be compressed. If you don't use it, you lose it, right? So if you start using your body more, well, your body's going to be way better off, and then you start holding your adjustments better if you do this specific